Welcome back. Joining us in the studio today is Dr. Christopher Pero, board-certified otolaryngologist at UT Health East Texas, the Ear, Nose, and Throat Center here in Tyler. So thank you so much for stopping by today.
Thank you. I'm happy to be here.
So we're talking a little bit about ear infections today. Is that because they're more common this time of year?
Actually, yes, they can be. So since the ears and the nose are connected, when we get this predominance of fall and winter colds and upper respiratory infections, often that unfortunately translates to the ears, and so we do get more ear infections in the fall and winter time.
And is that more common in maybe adults or the kiddos?
So really we see it mostly in kids, but occasionally adults will come through still with ear infections. Most of the time we grow out of that after age 6 as the Eustachian tubes develop, and thankfully ear infections don't haunt adults as commonly, but it certainly can happen and we do treat them.
So what are some signs that maybe tubes might be needed? Yeah,
so the most common indication for ear tube placement really would be recurrence of ear infections, and by ear infection I mean a middle ear infection, otitis media as it's called. And so if you have more than 3 ear infections in 6 months or 4 in a year, those are kind of the classic indications to consider putting an ear tube in. Another reason would be if you have fluid that persists in the middle ear space or behind the eardrum for more than 3 months, and that's contributing to some hearing loss or some speech delay, then we want to do something about that and consider putting in ear tubes as well.
So do you have any non-surgical options then maybe for people suffering with this? Yeah.
So the classic treatment for an ear infection, middle ear infection, would be either observation or antibiotics, usually oral antibiotics. And then if that doesn't work, or if it's required more than a few times in a row, then we consider putting in ear tubes, of course, approach with surgery. But it's usually medically treated in most cases, and most patients won't require more than that.
So what are adenoids?
Yeah, so this word kind of creates a lot of mystery, but adenoids are like tonsils, but tonsils are in the back of the throat. Adenoids are actually in the back of the nose, the very back of the nose. And so instead of having 2 tonsils like we do, or 2 adenoids, we have just 1. And so that sits there, and unfortunately, by its position, can cause nasal obstruction and can become infected. And so big adenoids or chronically infected adenoids can cause nasal breathing problems, can cause repeated sinus infections, especially in children. And then because of their proximity to the Eustachian tube openings, they can actually lead to increased risk for ear infections as well.
So you mentioned kind of tonsils. I know sometimes people have their tonsils removed to avoid that irritation. Is there a similar procedure to have your adenoids removed?
Yeah, there is. So adenoidectomy actually is a lot less to go through than a tonsillectomy for the recovery. There's a lot less discomfort and pain associated with it. It's a very safe and straightforward procedure, done of course in the operating room under anesthesia, but it only takes about 20 minutes to do it, and patients are very happy afterwards. Removing that adenoid pad can make nasal breathing better, reduce the incidence of sinus infections in kids, and then reduce the incidence of the ear infections as well too.
Awesome. Well, thank you so much for stopping by here today. Where are y'all located if people want to find out more information?
Yeah, so we're at 2210 Three Lakes Parkway.
Awesome. And then it looks like the website's right there on the screen. Is there a good contact number for your office?
Yes, 903-747-4098 is the best number.
All right. Thanks so much, Dr. Pero.
Thank you.